Hi everyone, this is Dr. Storr from Timonian Foot and Ankle Center, and I wanted to share a case that came in today that is a fairly common case, and we see a handful of times a month. And this was a case where I had a young gentleman, about 30 years old, come in to see me, and he had a very painful, red, hot, swollen big toe joint, the joint where the big toe meets the metatarsal bone. And essentially, he came in and said that a few days prior, he woke up and his foot was red hot and swollen. It's just progressively gotten worse. He can't put a shoe on, he can't put a sock on, he can barely walk. He's limping around. And he said to me, I'm not really sure why this is happening. I played golf the other day, I worked out, I ran, I didn't hit my foot, I didn't injure it, I didn't drop it on anything, and I am just in a lot of pain and I have no idea why. And I looked at his foot, and sure enough, he had this red hot swollen foot. The outside of his foot was all swollen. You could tell he'd been walking on the side of the foot. And I asked him if anybody in his family had gout. And he said to me, no, I don't really know what gout is. Well, what is gout? We hear about gout all the time, or the gout. You'll hear people say, I have the gout. Gout is a condition where uric acid, which is a breakdown product of protein, we eat protein, and our body excretes protein through our urine. Uric acid can build up, and in certain patients, it precipitates out of solution into the joint. And what that basically means, precipitate out of solution, means if you have a jar of water and you have salt, and if you dump the salt in the water and mix it together and you still have water, you're in solution. But at a certain point, if that salt keeps adding up and there's more salt than water, that means it's precipitated out of solution. And that can occur when uric acid precipitates out of solution and gets into the joints. And when that happens, when that happens, a patient is having a gouty attack. And gouty attack is an extremely painful event. An acute gouty attack is an extremely painful event where patients get these red, hot, swollen joints. And it more commonly occurs in the foot and ankle. It can occur in the elbow, it can occur in the knees, it can occur in multiple joints throughout the body, in the hands. And these patients have extreme pain, difficulty walking, and they need to get out of pain. So what do? Well, what we typically do is we take their medical history, see if there's any medications that may be causing it. Blood pressure medications sometimes can trigger gout. We ask them about their diet, see if there's any foods that may be triggering their gout, and we get them out of the acute pain. There are two parts of managing gout. You have to manage the acute pain, and then you have to manage the condition chronically. Managing the acute pain typically involves some medication. In my practice, I prefer to use steroid injections because that really focally treats the condition. And a lot of times we'll also add some oral anti-inflammatory medications. Sometimes we'll use oral steroid medications that will also control the pain and swelling. We'll get patients icing their foot, elevating their foot, resting. We'll either put them in a surgical shoe or walking boot if they're really compensating their gait. And we try to get this acute pain gone. Typically, if we treat them successfully, their acute pain is gone within about 12 to 24 hours, and sometimes there's some lingering pain for a few days or even sometimes a week or two. Part of the longer term treatment of gout is getting them get their uric acid levels into the normal range. This requires drawing some blood, checking their levels, sending it off to the lab after starting and taking some medication and making sure they're on the right medications. In extreme cases where we can't get the levels under control, or if patients have these big white nodules that are called gouty tophi, there are some real great options, which are infusion medications, where patients go to an infusion center and they get IV medication, which can help eliminate uric acid in the joints and lower the uric acid levels. But it's really important to maintain normal uric acid levels in these patients so they don't get chronic gout. Chronic gout leads to joint destruction, and if the joint destruction gets real bad, it takes us to the operating room where we have to do reconstructive surgery. I've had a handful of cases over the years where we've had to fuse joints because of severe gout, and we really like to avoid that. So, if you wake up and you have pain and you're not sure why, and your foot is red, it's hot, it's swollen, and you're just not sure what's going on, gout is always one of those conditions that we consider, especially when there's been no history of injury. And it's always a good reminder to know your family history. Know if gout is in your family. Know if heart disease is in your family. Know if strokes are in your family. Know if cancer is in your family. Knowing your medical history can always help. Medical history and your family history can always help us make the proper diagnosis. Have a great day. Thanks.